Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of men, starting with the letter P. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hairs, ears, eyes, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, and after that I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, and childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. Of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of men, continuing with the letter P. This section covers those disorders that affect the male reproductive organs. Infections are the commonest kind of disorders that affect the male reproductive system. For although the male urethra is relatively long and less prone to invasion than the female, it has direct communication with the testes, epididymis, and prostate. This means that kidney, bladder, or urethral infections can spread to the organs concerned with male reproduction. The testicles manufacture sperm and also produce the male sex hormone testosterone. They lie outside the body because sperm production requires slightly cooler conditions than those that occur inside the body, and the left testicle is usually lower than the right one. Normally, both testicles descend into the scrotum, which is the pouch of skin behind the penis, shortly before birth. At puberty, they enlarge and begin to produce sperm. Each testicle consists of an almond-shaped testes, where sperm are manufactured at the rate of 10 to 30 billion a month, and a much-coiled tube called the epididymis, inside which the sperm mature for about 3 weeks. In all, it takes 60 to 72 days for a sperm to develop fully. From the epididymis, sperm move into the vasa deferentia and seminal vesicles for storage. In the seminal vesicles, a sugar-rich fluid is added to provide the sperm with energy. If mature sperm are not ejaculated, they disintegrate and are reabsorbed into the body. But if ejaculation occurs, the seminal vesicles and prostate gland contract powerfully and expel about a half a teaspoon of semen into the urethra and out of the end of the penis and out into the female reproductive tract. Sperm have a maximum life of 3 days. It is not possible to urinate and ejaculate at the same time because the reflexes that cause the bladder to empty automatically shut off entry of semen into the urethra. The prostate gland is bulb-shaped and completely encircles the urethra at the point where it leaves the bladder. Its role is to add acids, trace elements, and enzymes to seminal fluid at the moment of ejaculation. These activate the sperm and also give semen its distinct smell. For reasons that are not known, the prostate tends to enlarge and stiffen with age, narrowing the exit of the bladder, thus obliging the bladder muscles to work harder to expel urine and can make urination slow and painful. The penis relies on its hydraulic power on 3 cylinders, 2 hollow and 1 spongy. These are arranged protectively around the urethra and only fill with blood during sexual arousal. Erection is maintained by strands of muscles at the base of the penis that slow the rate at which the blood drains back into general circulation. The head of the penis is most sensitive to touch, and the shaft of the penis is most sensitive to pressure. Penis problems. Balantis is the swelling and soreness of the foreskin or head of the penis, often caused by friction against damp underwear or by irritants in condoms and contraceptive creams. It can also be caused by the herpes virus. Balantis is most common in men who suffer from diabetes mellitus, since sugar in urine encourages microbes to flourish. If the homeopathic remedy and self-help measures that follow do not clear the problem up, see your doctor. An antibiotic cream will probably be prescribed, but if inflammation keeps recurring, making it difficult or painful to draw back the foreskin, the doctor may recommend circumcision. Specific remedy to be taken every 4 hours for up to 5 days. Mercurius 6C. Self-help. In addition to taking the Mercurius 6C remedy, bathe the foreskin and head of the penis with hypercarium and calendula solution, which is made by using 5 drops of the mother tincture of each in a half pint of boiled, then cooled water every 4 hours. It's important to always keep the penis clean and dry and wash well under the foreskin. Blood in the sperm is called hemospermia and appears as pink, red, or brown streaks in semen due to the rupture of small veins in the urethra during erection. It is quite common but harmless and usually clears up within a day or 2. However, if blood appears in the urine, see your doctor as soon as possible. Injury. Injury to the male sex organs usually involves the testicles rather than the penis, bearing the brunt of the blows to the groin. The most common injury to the penis is getting it caught in zippers. If this happens, cut the zipper free of the garment and go to the nearest hospital emergency department. In the meantime, bathe the wound with hypercarium and calendula solution, made with 5 drops of mother tincture of each to a half a pint of boiled and cooled water. Attempting to undo the zipper, especially if you are not circumcised, may make matters worse. Painful penis. If pain accompanies erection, the cause may be phimosis, which is the foreskin being too tight, or priapism, which is an erection occurring in the absence of sexual excitement. If pain is felt during intercourse, the partner's vagina may be too dry. After intercourse, inflammation or soreness may be due to chemicals in the condom, cap, spermicidal creams, and things of this nature. Redness or swelling at the head of the penis may be balantus. Painful open sores are likely to be due to herpes, lumps, or bumps caused by penile warts, or syphilis are generally painless. Penile warts are called condylomata. Like warts elsewhere on the body, they are virally caused and moderately contagious. They are not necessarily contracted through sexual intercourse, although susceptible individuals easily become reinfected if the partner has genital warts. Since wart-like growths can be the first sign of cancer of the penis or of syphilis, so it is important to see your doctor for a diagnosis as soon as possible. Genital warts are conventionally treated by very careful applications of specially prescribed wart paint. Over-the-counter preparations should be avoided. The homeopathic treatment for genital warts is constitutional, and while treatment is being sought, one of the remedies that follow should be tried. Your partner should also be examined and treated if necessary. Specific remedies, to be taken 4 times daily for up to 14 days. Remedy of first resort, use Thuja, 6C. If Thuja produces no improvement, and if the foreskin is swollen and warts bleed, use Cinnabar, 6C. Warts accompanied by inability to obtain erection or by great increase in sexual desire and premature ejaculation, use Lycopodium, 6C. Priapsism is a rare and painful condition in which the penis erects and stays erect even though the man is not sexually aroused. The cause of priapism is a sudden, inexplicable obstruction of the outflow of blood from the penis, or injury to the nerves in the spinal cord. A priapic erection lasting longer than 3 to 4 hours can do lasting damage to the spongy tissue of the penis, making further erections impossible, so appropriate action is to seek a doctor within 2 hours. Surgery may be needed to assist excess blood in penis to drain back into general circulation. In the meantime, give one of the homeopathic remedies that follow. Specific remedies, to be given every 25 minutes for up to 10 doses. General feebleness and impotence, use Brom, 6C. Erection usually painful, use Cantharis, 6C. General sluggish venous system, the individual may have piles or varicose veins, use Carbo, 6C. Self-help. A 3-week course of vitamin E is strongly recommended. Take 100 units a day to begin with. Increase intake to 600 units a day. If suffering from high blood pressure, see your doctor first, as vitamin E can temporarily raise blood pressure. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.